Hello, my name is Robert Henry. I am a student enrolled at Colorado Christian University and currently taking the Healthcare Administration Capstone. Talk about Dr. Bull. What follows is a short proposal on the COVID vaccination plan for the Colorado Army National Guard. The background for this project began with the COVID-19 pandemic occurring in the military. The LA Times reported the Pentagon already has canceled or reduced several large-scale training exercises, halted the movement of troops overseas and domestically, confined the aircraft carrier Theodore Roosevelt to port in Guam after an outbreak aboard the warship, and shuttered many of its recruiting offices around the country. Cloud's report went on to state that while the National Guard was beginning to mobilize to assist, at the same time, senior Pentagon officials and top commanders grappled with the potential effect on military operations and potential risks to national security if thousands of U.S. military personnel became sick or needed to be quarantined. Specific to the Colorado National Guard, by order of Governor Jared Polis, the Colorado National Guard assisted the State Emergency Operations Center and the Colorado Department of Public Health and Environment by administering nearly 900 COVID-19 tests of residents and staff at long-term care facilities in multiple Colorado communities. About 70 Colorado National Guard members from the chemical, biological, radiological, and nuclear and high-yield explosive enhanced response force package based at Buckley Air Force Base, Aurora, Colorado, conducted testing. The lab test resulted in 20 positive cases in facilities in Colorado Springs, Springfield, and Thornton. Colorado Citizens Warriors will continue to work with these and other senior living facilities to protect this vulnerable population and to stop the spread of the virus within these communities. We will continue to be ready to respond to requests from the state to support any other long-term care facilities. The Adjutant General of Colorado, U.S. Army Major General Mike Lowe, said the National Guard is providing necessary capability and capacity to help our local and state partners to save lives across our state. More than 420 Colorado National Guard members are currently mobilized for the COVID-19 response. More than 275 Colorado National Guard members are supporting the city and county of Denver to shelter people in Denver experiencing homelessness. About 50 soldiers are assisting the state with U.S. Army Corps of Engineers to convert the Colorado Convention Center in Denver, Colorado, and the Ranch Events Complex in Loveland, Colorado, into medical shelters. The Colorado National Guard is also providing planners to support local emergency operations centers and other Colorado communities that this state has designated. All Colorado National Guard members have been screened and are on Title 32 federally funded orders under state control. Approximately 30 soldiers and airmen continue to serve in their full-time roles supporting the Colorado National Guard operation from Joint Force Headquarters in Centennial, Colorado. Our priorities are to protect our force and families and all Americans and maintain our wartime readiness while supporting our state, local, and federal partners to prevent the spread of disease and save lives. As of January 2021, members of the Colorado National Guard have begun to receive COVID-19 vaccinations on a limited and voluntary scope. With a focus on beating the virus and protecting our force, our families, and our communities, our Colorado National Guard leaders are stepping up to set the example and encourage all members of the Colorado National Guard and our Colorado communities to get the COVID-19 vaccine. The Adjutant General of Colorado, U.S. Army Brigadier General Laura Clellan said. However, social distancing and mask wearing is still required, and no more than 50% of the unit can be present for training, and this continues to negatively impact the readiness of units to support state and federal missions. The Colorado Army National Guard provides a force of 3,800 soldiers from a diverse force structure to support federal and state missions. Force structure includes aviation, field artillery, infantry, medical, military police, and special forces. The soldiers supporting the task force dealing with the COVID-19 response have already been infected by the virus. The Army Times reported just this past December that the first person in the U.S. known to be infected with a new and apparently more contagious variant of the coronavirus was identified Wednesday as a Colorado National Guardsman who has been sent to help out at a nursing home struggling with an outbreak. And health officials said a second guard member may have it too. The cases have triggered a host of questions about the mutant version circulating in England, arrived in the US, and whether it is too late to stop it now, with top experts saying it probably already spreading elsewhere in the country. The discovery has also added urgency to the nation's vaccination drive. A Colorado National Guard member has tested positive for a new COVID-19 strain, said Air Force Second Lieutenant Katie Lee, a Colorado National Guard spokesperson, in an email to Military Times. The two Guard members have been dispatched on December 23rd to work at the Good Samaritan Society nursing home in the small town of Simla, a mostly rural area about 90 miles outside of Denver, said Dr. Rachel Hurley, state epidemiologist. They were among 6 Guard members sent to the home. At least 80 Guard troops are currently on Title 32 orders throughout the state, administering COVID-19 tests and distributing COVID-19 vaccine, said Lee. In a statement to Military Times, Army Brigadier General Laura Cleland, the Colorado's Adjutant General, described the current moment. It is a challenging time, and it is our longest and largest domestic response in state history. But we have successfully balanced readiness demands against the need for a higher level of health and safety protections across the force. They explained that the state has been isolating critical personnel, dividing units into separate cohorts, and following CDC recommendations. A state laboratory began looking for signs of the variant after its spread was announced in England earlier this month, Hirely said. Staff and residents at the nursing home who tested positive for coronavirus are having their samples screened for the variant, and so far no evidence of it has been found, she said. This shows the need to vaccinate the soldiers of the organization to prevent the spread of the infection and also provide a force ready and capable of responding to federal and state missions. And as stated before, the cost of sending soldiers for training or exercises is greatly increased due to restrictions of movement and additional 14-day quarantine timelines. The force structure is so that the first is the governor, the adjutant general of the Colorado Army National Guard, the commander of the Colorado Army National Guard, the office of the state surgeon, and how they would need to approve any vaccination plan in accordance with HHS and CDC guidance. The Colorado Army National Guard G3 operations, the medical detachment for the Colorado Army National Guard, the 928th Medical Company area support, and subordinate unit commanders within the Colorado Army National Guard. The commander and soldiers of both the medical detachment and the 928th Medical Company area support would be the 2 units responsible for carrying out the mission, as they have the personnel to medical providers and combat medics to meet the mission requirements. To train, the goals are to train, vaccinate, equip, and employ the 928th Medical Company area support combat medics and medical providers, physician assistants, and nurses as the COVID-19 vaccination task force to vaccinate the units within the Colorado Army National Guard. The second goal is to establish a priority, schedule, and percentage of personnel required to be vaccinated to establish herd immunity within the Colorado Army National Guard to allow units to resume normal operations and be capable of and ready to respond to federal and state missions. Requirements, training. Those combat medics and medical providers administering vaccination must complete required online training regarding screening patients, documentation, and cold chain storage of the vaccine. Supplies. The correct number of vaccines required by each unit. All supplies required to administer the vaccine and PPE required to conduct the mission. Funding for paying allowances and related travel expenses to include lodging, meals, mileage, and anything additional as the mission requires, and to pay for required supplies. Legal protections for those administering and transporting the vaccine. Tools include cost-benefit analysis, which will be conducted for 3 possible courses of action, briefs, which will detail the required manpower, training, supplies, and funding that will be required by each plan. To conduct the benefit analysis, computer programs that will be utilized are the Automated Funds Cost Order System, Defense Travel System, Medical Operation Data System, Integrated Personnel and Pay System, Army, among other programs. The military decision-making process will be applied to the course of action briefs, and a course will be selected by the key stakeholders. Literature review number 1. Kaufman reported on the military responses to COVID-19 around the world. His observation is that many governments have mobilized their military to assist during the COVID-19 pandemic. Military support has included logistics of moving medical supplies and relocating patients, deployment of Army medical logistic planners, transportation of healthcare workers, and disinfection of public spaces, including medical facilities. Troops have been utilized to assist those impacted negatively by the lockdowns by supporting food banks and delivering meals. Other medical contributions by armed forces are the development and testing of possible vaccines and the production of medical supplies, including face masks and disinfectants. More controversially, however, troops have been deployed to enforce mandatory lockdowns by patrolling the streets, constructing roadblocks, and curbing movement. These measures, which aim to stem the spread of coronavirus, have been adapted throughout the world. As Kaufman's article illustrates, the military is already being employed as a resource. It should be capable of vaccinating its own people to prevent the spread of the virus and increase herd immunity. Literature review number 2. The Center for Disease Control has published a 2021 vaccine storage and handling toolkit that implements best practices for vaccine storage and handling based on the Advisory Committee on Immunization Practices recommendations. The toolkit covers the following: vaccine cold chain, staff and training, vaccine storage and temperature monitoring equipment, vaccine inventory management, vaccine preparation, vaccine transport, and emergency vaccine storage and handling. Of importance is the COVID-19 vaccine amendment, which covers the COVID-19 vaccine storage and handling. Literature review number 3. Anderson et al. Point out that the pressure is mounted to create herd immunity from COVID-19, but in order to achieve that, 80% of the population will need to be vaccinated. However, duration of the vaccine's effectiveness may remain unknown for some time. While antibodies appear present in those who have recovered, they are only but one part of the immune response, and protection may only last 12 to 18 months. Calculations on herd immunity are difficult to ascertain. Estimates are based on assumptions that satisfactory and greater than 80%. However, the length of the protection being short, 1 to 2 years, then herd immunity may be hard to reach. Literature review number 4. Omer, Yildirim, and Foreman point out that the failed attempt of Sweden to forego lockdown to create herd immunity only resulted in less than 8% of seroprevalence in Stockholm. Of the 330 million citizens in the United States, 198 million would require vaccination to reach 60% herd immunity, which would still result in several 100,000 additional deaths. The authors conclude vaccines must not only be effective, but vaccination programs must be efficient and broadly adopted to ensure that those who cannot be directly protected will nonetheless derive relative protections. Literature review number 5. Department of Defense News reported on the COVID-19 vaccination distribution plan, which detailed the plan to distribute 43,875 doses, of which the National Guard was allocated to share. Two key considerations made by the plan were who should receive the vaccine and the most effective locations to receive and administer the vaccine. Limited availability of the vaccine will also drive the decision on the prioritization of who, where, and when the vaccine will be administered. Colorado Army National Guard was not on the list that identified, which may impact when the vaccination program could reach the level desired and needed. Summary. The proposal is to move forward with the training, vaccination, equipping, and mobilization of the 928th Medical Company Area Support to conduct COVID-19 vaccination to create herd immunity within the Colorado Army National Guard. As literature reviews revealed, the military is already serving on the front lines, assisting with the response to the COVID-19 pandemic, placing themselves directly in harm's way. Herd immunity must be reached if the Colorado Army National Guard is going to resume full-time operations and be prepared and ready to serve our communities, our state, and our nation. Biblical influence. He said, "Come." So Peter got out of the boat, walked on the water, and came to Jesus. And when he saw the wind, he was afraid, and beginning to sink, he cried out, "Lord, save me." Jesus immediately reached out his hand and took a hold of him, saying to him, "O you of little faith, why do you doubt?" When called to go into action, we must not doubt God's ability to guide and protect us. As soldiers, we are called to go into harm's way and to protect the citizens of this nation. And we must not doubt God's ability to protect us if called to serve our community, state, or nation. The following slides contain the references used in this presentation. Thank you for your time and attention.